First on the, pardon me?
Oh, it's just the system saying that we are recording,
Oh,
so we're good
Thank
to
you.
go.
We'll have to get used to this. First on the agenda is the approval of minutes. What is your pleasure?
Move that we approve.
Second,
Move
Tenorio.
second. All those in favor?
Aye.
Aye.
Opposed? Carried. Next is the matters for discussion, for action. First is the communicable disease update.
Actually, Ashley is going to be joining us momentarily, so if you would be okay to start with number 2, Francis is going to present on the Violence-Free Coalition.
Oh, excellent. So we'll have the Violence-Free West Allis Coalition presentation now.
And I will have to share that. I got you covered, Francis.
Okay, yeah, just if you could share the slides, that would be great. Perfect. All right, and then if you just want to put it in the presentation mode. It's the button that says from the beginning on the far left-hand side under the word file. Or you could press the button next to the 69% at the bottom right. Yep, that one. Okay, can everyone hear me?
Yes.
Wonderful.
Yes.
So as Bob said, my name is Francis. I'm a public health specialist here at the health department. And today I'm going to be talking to you a little bit about our Violence-Free West Allis Collaborative and our small grant program. I'm really talking about how community partnerships, data, and collaboration have helped to change the landscape of violence and what work we're doing. So as I mentioned before, what we're talking about today is called the Violence-Free West Allis Collaborative. You might often hear that called VIFWAC. That's just an acronym. And on that leadership team is me and Bob. As you can see, there's a yellow star next to us. And then we're joined by 4 of our colleagues from the Medical College of Wisconsin who also sit on that leadership team and help us, develop an actionable way forward using data and partnerships to reduce violence in our city. You can advance. So a lot of the times when I start talking about this, the first question on everyone's mind is, wait, how did you guys even determine that this was something important that we needed to discuss and prevent? And this all was started in 2015 when we did our community health survey. And we surveyed the community to find out what is important to you in your community. What are the top 3 health issues? And then you can click through 3 times, Bob. And the top 3 options that they chose were alcohol and drug use, chronic disease, mental health or depression, and believe it or not, violence. And so in 2015, our community, the people who live in West Allis, told us that a top priority and a top health issue for them was the amount of violence happening in our city. And you can go forward. And that led to the collaboration of the Violence-Free West Allis Collaborative, which is a collection of a lot of different agencies in West Allis, different community groups, and people who are just generally interested and have stake in reducing the amount of violence in West Allis. You can go forward. The mission of our collaborative is to promote a safe and healthy community through data collection, education, resource leveraging, and policy advocacy. And all 4 of those components are very, very important to how we do our work. And I'll go through those a little bit in the rest of the presentation. You can go forward. these are just some of our community partners on our VIFWAC, our Violence Free West Allis Collaborative team. So you can see a lot of the major health systems are represented, like Aurora, Freighter, the Medical College, Ascension. We also have some smaller health services like Community Medical Center, Rogers. We have Children's Hospital, some local churches, even the Wisconsin State Fair, the school district, the fire department, Impact 211, the rec department. And these are just some of our partners in that work. It's the biggest part of this collaborative is using collective impact to make a difference and using our shared information to actually put things forward and make West Allis a safer place to live. You can go forward. The model that we use to push our work forward is called the Cardiff Violence Prevention Model. This was started in the UK actually, and it just seemed to really fit for West Allis. And so we have been working very hard with the experts at the Medical College of Wisconsin to implement this model into our city. The basis is information sharing so that we can gain an understanding. So this is really, really rooted in data so that we can find out exactly where we're going to put our resources. One of the hardest things about working in a public health agency is that resources are limited. Sure, we do have resources, but we don't have an unlimited amount of resources. And so with that limited amount of resources, we want to best put them where they're really needed. And this is really where Cardiff comes in. We want to understand where violence is happening and really share that information out to community partners so that we can best put those resources where they're needed. This is an issue of equity, right? We're not giving everyone the same thing. We're giving people what they need and when they need it. And the Cardiff model really helps us to identify and share what that is and where and how we can implement solutions to violence. You can go forward. So let's get into the meat of it. Let's really find out how this collaborative is working. We've had some really exciting things happen lately. The biggest thing is that we started a small grant program for violence and opioid prevention in the city of West Allis. This is through a grant from the Bureau of Justice Assistance, and we created these like small mini grants. So people could request grants for up to $10,000 unless they were working collaboratively with other organizations in which they could request above that amount. And so to date, we've funded 3 projects. You can move forward. And what we really urge these grantees to do is use our data, use the information that we've collected about our city to provide solutions. So you can see on the screen right here is a map of some of the violence that happened in February to March of 2021. You can see that around Liberty Heights Park is a hot zone for violence, and all along Greenfield Ave. And so when we're creating solutions, we want to create solutions and programs and services and input, that those resources where they're really needed. And so we ask that all of our community partners take this data to heart and look at it and consider it when making changes in services and programs. You can move forward. Not only can we look at data from the past 2 months, but we can look at it over time. So we can see the change from month to month and we can compare. And so at our meeting that happens every other month, we look at the most current data, but we also look back through the year and compare year to year so that we can see, how is this data changing? How is it staying the same? Is this a fluke month? Is this something that we really need to pay attention to? Did something flare up in the last month and why? So it really gives us a wonderful picture of where violence is happening in West Allis. You can move forward. To date, we've funded 3 programs so far for a combined total of just over $31,000. And so that's $31,000 going directly into the West Allis community to reduce violence and opioid use. So I'm going to take you through those 3 grants that we funded and how those 3 agencies have used this data that we got by implementing the Cardiff model into making our city safer. You can move forward.
Francis, could I just ask a question?
Sure thing.
Yeah. Because I live in the Liberty Heights area, I'm wondering what the nature of the crime is. Is this a person on person, or is this some of the robbery that goes on at Walgreens? What exactly is?
Yeah, great question. So we take data from the emergency medical services, the police, and the hospitals. Right now, we are working hard to get better access to hospital data, but to be quite honest with you, the quality of our hospital data is lacking. So most of our data comes from police or emergency medical services, EMS reports. And so that can be anything from domestic violence to a fight, to gun violence, to a robbery, anything that involves violence. I've been showing you guys the overall density map. In some of the other slides, you'll see the fire and the police. So this is all three of those data points combined to form a heat map. And so it is just the gamut of anything that was reported related to violence. In the EMS and police world, they'll do a report after they respond to an incident. And in the emergency department, they are supposed to screen people, every person that comes into the emergency department, if the reason that they are there is because of a violent act. And then they'll fill out a specialized survey about what happened. What we're really interested to know with this information is where it happened. So location is super, super important, because Cardiff is a place-based model, meaning we want to implement solutions where the violence is happening. So to answer your question, it's all different kinds of violence. We see particularly high domestic violence in West Dallas, which is definitely harder to find a solution for as compared to like a fight outside of a bar. Did that answer your question?
Yes,
Okay,
thank you.
Wonderful. Does anyone else have questions?
Yeah, I have a question, Francis.
Yeah.
Is this data collected also identifying if these victims or individuals are actually West Allis residents?
This data is all where the incident happened. So if the violence happened in West Dallas, it would get reported. So if it happened at a bar and someone didn't live in West Dallas, that data point would still get put on our violence data in that heat map. So they don't have to live in West Dallas, because we're just recording where the violent act happened.
I think that unfortunate, and I hear what you're saying. Obviously, I also live in this area, and these numbers are not pleasant in any way to see, but I know that we do tend to have a lot of fluid coming from Milwaukee, being so close to that, to the border. And I know that oftentimes some of the OD incidents that have occurred are also not West Allis residents. They are just sometimes choosing, for lack of a better word, our neighborhood.
Yeah.
And so I think that this unfortunately creates at times an image, right, of a neighborhood that is not necessarily a representation of what the neighborhood is. And so I just wanted to kind of put it out there that some of this may not always represent, the neighborhood. I also do think that we have such a high number of renters in this area as well. So I think there's constant movement in and out of residents.
That's definitely the case. There's a lot of non-home owners that live in that part of West Dallas and into West Milwaukee. And so that is something that our ViolenceFree West Dallas Collaborative really struggles with. With people, how do we reach people? And that's something that we're working every time we meet to come up with an answer. And the solutions are not just coming from the West Dallas Health Department. They're coming from community medical services, the police, the fire, the heroin opiate task force that Joni Lukey runs. And so it's just sort of like a melding of the minds, and just using the data to support why we're putting resources certain places. And so I totally hear you in that sometimes it's easy to see data and to let it sort of tell you a negative story. And that's not our point here. We're not trying to say like, oh, that part of West Dallas is really dangerous. That's definitely not what we're doing. It's just saying like, we recognize a need for more resources in that area. And if we have resources, let's put them there. If we have school programs that we can better support families, let's put them there. And so that's sort of more of our goal, but that's definitely something that I'll take back to the collaborative, Daisy, is that to look a little bit beyond the purple circle, right? Why is that happening? Who lives there? Are these people residents? Like, that's a great point to find out, like, can we stratify the data to find out if these people live in West Dallas or they don't? And if we can take out the people that do not live in West Dallas, how does that change the data? That would be a really interesting overlay. One of the really cool parts about this grant that we have is we have a really wonderful partnership with the Medical College of Wisconsin, and we basically have our own data analyst. Sarah Kolbeck is our lead data scientist on this project, and so she has many more resources than I do to really understand, stratify, and manipulate the data to answer questions that we might have. So if you guys have any questions about the data that are not answered today, feel free to shoot me an email and I can see like what kind of information Sarah can pull for us to form a more holistic picture of what's going on. Or if you're like, I wonder if we added this qualifier to the data, how it would change it, how it would change the picture. We're always looking. Yeah, go ahead.
I think it's specific. I mean, I don't know if you're going to share that, but I'm also would be interested in knowing age groups. I'm wondering if this is happening mainly with younger adults. Are we accounting for children, juvenile situations? Are we only looking at adults? And then again, age group would really make a difference, at least in understanding more of the dynamics that we're seeing.
Yeah. Today I'm not sharing that. Today is just a really general overview. If we want to do a deep data dive, I would want to invite our data analyst, Sarah, to the meeting. If you guys are interested in this topic, we would love to present more. This is just supposed to serve as like a brief overview and update of kind of what's going on, but we would love to take a little bit deeper dive. And I would definitely bring Sarah, who, you know, she just has the correct phrasing and the correct way to present it. And more of an expert hold on the specifics of the data. Any other questions? All right, awesome. So let's look at 3 ways that we put this data into action, the 3 ways that we're funding current projects to help data and opioid prevention in our city. So the first one is an organization called Take Back, still the other slide, Bob. Back one.
Okay.
Just press your back arrow.
Well,
I don't know what slide. Yeah, that one.
Yep.
Yeah. Okay. So our first project that we funded is from an organization called Take Back My Meds. And Take Back My Meds provides medicine drop boxes. So we are going to install one on the Aurora Clinic, at the Aurora Clinic on 69th and Greenfield, which is a violence hotspot. One thing that is so complex about violence and opioid prevention is that they rarely happen in silo, right? It's usually if there's violence, there's some sort of other thing going on, whether it's mental health, opioid abuse, drug abuse. It's usually things are happening in tangent together. And so we see that opioid and violence prevention as something we can tackle together. And so that's why this medicine drop box is going to be installed there. But the really cool part is that Take Back My Meds Milwaukee, who operates in all of Milwaukee County, has partnered with our West Dallas Fire Department and the Mobile Integrated Health Team to train officers to ask people when they're on calls if they have medicine that they need to dispose of. And if they do, they will transport that person to the box to drop it off. And so it's not only putting a box in Aurora, which we have talked with Aurora, and they're going to advertise this box and make sure that clients know that it's there. But we also have West Allis paramedics, MIH team in the field that is going to advocate for people properly disposing of their medicine. It's just that one extra touch. Do you have a medicine in your house that you're no longer using? Let's get rid of it. Let's make it more safe for you and your family here at your home. And so, as you can see, I teed in those dotted lines 69th and Greenfield. So we're so excited to have this box there because it's right in one of our hot zones. And so we see it as a perfect location. It was definitely a gap in where people can drop off medicine drop boxes. And so that is our first one. We can move to the second one now. Our second one, we gave a small grant program to the West Allis Fire Department and the MIH team. The MIH team stands for Mobile Integrated Health. The fire department has done an excellent job being boots on the ground advocates for health in our city. They reach people where the health department can't. They can respond to calls and really be out in the community and be helping people every day. And this MIH team does just that. And so what the small grant program is going to do for this team is allow them to expand some of their services. For instance, they are going to purchase a patient tracking software, which when they come into contact with someone, instead of just saying like, do you have, do you need help with anything? They'll be able to see sort of their patient history. Have they been to a treatment facility? Have they been to a hospital? They'll be able to get a better picture of someone and how best to help and treat that person while they're on a call. The second thing that they're going to implement is something called a telehealth system, which means that now that they found out a little bit more patient history, if someone needs a service, instead of saying like, okay, well, I really think you should go see this counselor, and maybe that person has to wait a week for an appointment to open up, they could virtually connect with a provider in the moment for that person to be seen virtually on a Zoom call just like this in the moment. And so they have that. Sometimes you have such a small window of yes to help someone. If they say yes, they need help that moment. And if you wait, it could be too long. It could be too late. And so the telehealth is really going to allow that yes moment, that connection moment to happen at the site, which we're really excited to see if that's something that is used and if it's helpful. This is brand new. We are pioneers in West Allis of services like this to our community. And then the last thing is that they're going to purchase fentanyl test strips. And so if you are not aware, fentanyl, which is basically a really, really strong opioid, is making its way into not only other opioids like heroin, but also into things like cocaine. And fentanyl is very strong, and just a little too much of it could be a fatal dose. And so we're trying to give people safer ways to use. While we don't necessarily encourage using, if you're going to use, we want you to not die, right? Like if there's too much fentanyl in a dose of heroin that you think is just heroin, you will overdose. And so the fentanyl test strips allow people to use more safely, which is a model that is being accepted throughout the country of keeping people safe and alive and moving them towards recovery, but meeting them where they are. All right, we can move to the next slide.
Can
Yeah.
I ask who uses the fentanyl strip? The person that finds them or the user?
The user. So let's say,
Okay.
let's say it's sort of like the needle exchange program that has been popular for a while. Instead of using a dirty needle and potentially like getting HIV from sharing needles, we would rather have you use a clean needle than use a dirty needle and infect yourself with a further disease.
Okay.
Same sort of concept. Yep.
Okay.
And the fire department is meeting with those people. For instance, every Monday and Wednesday, they go out into the community and meet with people from 2 to 4. And so like those are opportunities to get resources like the fentanyl test strips out there. Any other questions about the first 2 grants we went over? All right, and then our
Well,
last.
I guess
Go ahead, Barbara.
if a user wants a fentanyl test strip, does that mean that they have to go to a police or fire person to get it? Or is there just some place anonymous so they may be more apt to use it?
Right now, we don't have a system set up where they could just anonymously go get one, but that is actually an excellent idea and something that I will bring up to Armando, who is one of the people at the fire department heading up this initiative. That's something really wonderful of like, how could they go and not have to have that interaction? Part of it is that we want them to have that interaction. So it's kind of hard. It's like a balancing act. Part of it is that we want them to have a positive interaction with a provider. Of someone saying, if you're ready for help, I'm here, but if not, I want you to use safely. So part of it is we want that, but I could totally see your side of that could prevent someone altogether from using that product. And so that's something that I'll definitely bring to the collective to see how they are, what they're doing about keeping that balance of encouraging people to use the supplies, but also not pushing them away. One of the excellent things is that people seem way more willing to interact with the fire department than the police department. And so that's one of the good things about the mobile integrated health team through the fire department is people are not as nervous to interact with those professionals and those people. And so that's definitely something that's helping is the fact that it's just a different person in our community, just that fire. Even though the police officer could also give them the fentanyl test strip, there's just a different stigma around it. And so that's definitely one step they've taken is sort of shared some of the responsibility across departments. I always say we all probably know the message, but it's the message coming from the right person. And like I used to ref sports and then I used to teach people to ref sports. If you saw me in person, you wouldn't think I know how to ref basketball. And so when I tell someone how to ref basketball, they get irritated because I don't look like I know how to ref. But if it comes from someone that looks like they know how to play basketball, the message is received way better. And that's sort of a similar concept. Like who's the best person the message can come from and how it will be best received and most effective. But I'm totally going to take that to the committee because I think that's an excellent point. Anyone else before we move on?
Francis, this is Mark Roberts. Does this grant include training for the firemen on how to interact and how to channel, if possible, that person for assistance? Number one. Number two, is that test strip provided in such a manner that there's information that goes with it? I mean, it's something as simple as a card with a quick message and a phone number. If you would like help, call this number, something like that.
Yeah, so the mobile integrated health, the MIH team is specially trained. They're their own subset of the fire department. And so this is what they do. This is like their full-time job. They're mobile integrated health firefighters and paramedics. So they do receive extra training and they're like continually improving. Additionally, I'm not sure when they get the fentanyl test strip, if they're getting other information, but if someone is handing it to them, they're certainly receiving verbal information and education about how to safely use it. And then also being provided information about how to get help if they want it and how to get help if they want it, even if it's not today. That's one of the awesome things about the West Allis Community Collaborative, which is what I talked about on Monday and Wednesday. They're there with the street angels and people from the community medical services, CMS, every week, just with providers waiting. They just wait for people to come to them. And if they need help, help is there. And so it's consistent. and it's in the same place and it's reliable. And so I don't know if they're giving out actual information cards. That's a great question, but they're certainly giving out verbal information, and they've definitely had a lot of training. That's one thing that our fire department is doing really well on, is being really creative about how to serve the community in this way and being really mindful. They are so good at using the skills they have and then partnering when they don't have the skills. And so if they need help on something, if something is outside of their scope of work, they have providers on hand throughout the city that they refer to, which is one of the really wonderful things about that grant and about all of these things working together. And one of the strengths that has come out of our Violence-Free West Allis Community Collaborative, our VIFWAC group, is just the melding of minds and the connections that we make. So, you know, we show up when we're needed, and we know how to pass off and refer when it's no longer in our scope of work. Did that answer the question?
Yes. Thank you.
Awesome. Anyone else? Other questions that I can answer?
Francis?
Yes. Hi,
There's
Rosalie.
there's a clinic on Highway 100 and National. I believe it's for people on fentanyl. Yes. Does the health department work in concert with them, or are they a separate entity? They have many, many people coming to this clinic for assistance, I believe.
For methadone,
Methadone
yeah.
clinic, yes. Are
Yeah,
we
we are.
involved in that at all?
We are in communication with them. That is one thing that we're definitely getting better at doing, and one of our collaborative's goals is what services do people have, who can offer the service the best, and how do we work in concert with each other. And so that is something that we're still working on, because that's such a great group, right? Like, people line up every single day to get that methadone. That is a group of people that we have that we know is going to show up for help. The other thing about that methadone clinic is that it so often gets such a bad rap. Like, people in the city are angry that it's there. They think those people are dirty, and they think it's making our city an unsafe place to be, which is so frustrating, because each one of those people have made a decision that day to be in recovery, to get better, to help themselves. And so a lot of it with stuff like that is just helping people understand that the people standing in that line are people trying to recover. And I think when you frame it that way, it's so powerful. So we're certainly working with them. We don't have any active projects, but we talk with them often. And that's definitely something I want to tap into. Something that I talked about on a call, I think 2 weeks ago, was better utilizing people in recovery to tell their story and to be advocates for other people starting their recovery journey. And so that's definitely something that's been top of my mind lately, of how do we better interact with people in recovery, people looking to start recovery, and that clinic in general. The other thing that me and Bob have on the top of our plane is the top of our mind is the new behavioral health clinic coming in. That will be a huge player for us in this space as well. Right now, they do not have their staff locked in. So we haven't made any connections yet. They're set to open in September, but they are short quite a few staff members right now. So we're waiting until they get a little bit more set on their feet to start making that connection and engaging with them in this work.
And then we will touch a little bit on CMS during Ashley's update on communicable diseases. So stay tuned.
Francis, Mark Roberts here again. A couple more questions. One of the things is, it would help in the presentation if you could define violence, because one of the things that worries me a little bit is that it's a shotgun approach, as has been some of the questions about domestic violence, versus other types of violence, and perpetrators being from locally versus, coming into the community. So one of the things is you've got three different types of programs, which is a really good start to find out what's effective. But the second thing is, how do you measure effectiveness? In business, we call it return on investment. And so, how are you measuring that in this process? Have you gotten to that point yet?
In terms of if the grant activities are effective,
Right. I mean,
or like our,
you could actually say what is the effect, or what are the goals? How do you measure that the project was successful by whatever measure they decide?
yeah, so each of the three grants we funded have specific goals that they've laid out for them, that they're going to achieve, and that's how they're going to show us that they were either effective or not effective. And then in all three of their plans, they needed to lay out a sustainability model. Now these grants are small in the scope of a city, right? Like $10,000 is going to get some activity going. But we're really looking at a citywide approach. And then as far as our violence-free collaborative, we have our own like measures for what we're going to do and accomplish in the grant. So our grant is managed by the BJA, the Bureau of Justice Assistance. And so then we're held to our things that we need to meet. As far as like tracking the data specifically and seeing changes in the data, we don't have any targets to meet. And that's because this is relatively new work, and relatively new programs that we're working to see like what's going to work here. We're using a model that was effective in a different place. Will it be effective here? And so far, we've done a really wonderful job meeting and getting people on board. We're having a hard time getting reliable data. That's just the truth of it. Data sharing is a hard business to be in. People are very protective over their data. It takes a long time to get contracts and MOUs signed. And so that's one of our goals, is to better data. So like you all have been saying, like we need better data. We know that. And it's just the process of getting that. So that's something we're actively working on, finding different partners, finding different ways. And that's why we're excited for the fire department to try that patient tracking software. We've been in talks with Impact Connect. And so, yeah, I guess we don't have like specific things, but in all of the grant agreements, we do have specific targets that we'll meet. And that's how we're tracking our progress in this work.
Great,
Daisy?
thank you.
Yeah.
How do we, I just keep thinking, I'm listening to all of this, and in my mind, I keep thinking, I wish that the rec department was here listening to this information, as they contribute a massive amount of resources to the park. And we know that this is where that hotspot is. And trying to think about how they can also be a source not only of data, but also preventative work. And I know that with the family meal program that we'll be seeing at the park and other things, I just know that the rec department has also played a very key role in trying to make sure that we keep these numbers low. I will probably tell you that my suspicion is that if we go back and look at prior numbers, we will probably not see the same spike that we're seeing right now. So few things, I'll blame COVID for this, but
Okay.
but I'm just in my mind, I keep thinking, right, as we're kind of opening up, as we're kind of seeing, I would really love to see what what the numbers will really look like, in another few months, just because I know that programming is coming and a greater presence at the park will be also happening. And so that with Burnham Point also opening up, and right, so I'm hopeful, even though we just had a shooting on 60th and Burnham, but we'll just pretend that that's just not going to happen anytime soon again. I'm just thinking, right? How do we get all those partners to be part of this process a little more to see if we can fluctuate that data more?
Totally.
Let me follow up to that, because I think that's one of the things, going back to my first question about the definition of violence. One of the things is, first of all, defining the violent act. Is it a confrontation between two people? You know, we've talked about maybe it's neighbors over a property line or at a bar or whatever, but looking at then by honing in on the type of violence. So I think that right now, looking at the different types of programs that you've funded, but then really look at it in terms of what is the violence that you're looking for, and what are the contributors to that. So I think that's one of the things to look into. You've talked about drugs, but are drugs a key factor in the violent acts that you're looking at, for example?
Right, right. And I apologize that I don't have more specific data. Bob asked me to make this a 10-minute presentation. So
We don't, when we get interested,
we
it's
love
more
data.
than 10 minutes.
okay. I just hit you guys with the broadest data I could find, because I thought he wanted it to be quick. And so we can certainly get more broken down data in the types of data. Like, I took out some of the specifics just for time's sake. But I certainly would be willing to put together like a more complete picture. And I just don't, I don't want to speak without it there, because I don't want to misrepresent some data that I'm just remembering off the top of my head. But definitely it's important to understand where this opioid use is happening, where the violence is happening, how they overlay, what type is it? Is it domestic? Is it with a weapon? Is it hand to hand? Where is it being reported? That's one of the things we're working super hard with the hospitals, is that a lot of violence doesn't get reported to the police or to EMS. Some people might just go to the hospital. And it's hard for a nurse to ask in the emergency department if you are there because of a violent act, especially if the person that they got hurt by is also there. Or, it's such a touchy subject. And so last week I presented to the Aurora Emergency Department nurses about why this is important, why we need them to ask these tough questions, how to ask these tough questions, how it fits into the overall system. But certainly I would be interested to hear all of y'all's feedback about how we make this data better. How do we actually get a good picture? I think the ViolenceFree Collaborative has a really wonderful starting point, but we're really working to better this data, better this information, because with more information, we can do better work, right? It's like, what do people actually need and want, and how do we tailor our services for that? And that's just a work in progress that we're working on every month to try to better get that. Allison, did you have a question?
Yeah, I'm curious. So I work for Rogers Behavioral Health, and I'm just wondering, being in the community, having a location in West Allis, if you guys have had, I know that they were represented in the beginning of the slide, but when we think about opioid use, substance use, education, even looking at peer support, if they've been involved, or if you guys have been able to connect with them in regards to education, or how to utilize the community, or how to utilize them within the community.
So that's a great question. We do have someone from Rogers, Kira, on our committee. We also have the school district. We've been working a lot with Sably Sabin. She's unfortunately retiring. So Larry, the person taking over, is starting to come into the picture. And we're also working with, in this grant, the one on the screen, the West Allis, West Milwaukee Heroin Opiate Task Force, which is run by Joni Lubke. This grant is in partnership with the rec department. So they are certainly at the table. These programs, these curriculum-based violence and substance abuse prevention programs will take place in partnership with the rec department. So they are certainly at the table. They already teach these skills to high school students. What we've realized is that sometimes by the time we get to a high school student, it's too late. They've already learned a behavior. We really need to start implementing this education and this knowledge and the way to avoid violence and drug abuse earlier, at an earlier age. It's really sad, but most kids that smoke before, have tried their first smoke before they're 13 years old. And so when you start thinking about it like that, you find the need to start educating and having these conversations with younger and younger kids, which is what our third grant is, with the Violence and Opiate Task Force. They are a curriculum-based program using Badavan life skills, which is evidence-based, to teach kids how to respond, how to live if they're experiencing this or someone in their family is experiencing violence and opioid, and what to do. And so that's really where this comes full circle, right? We have grants that impact people who are currently experiencing violence or opioid addiction. We have a place for them to put it. We have trained officers in the community ready to do that. But this part of the grant is really education based, and education to a younger group of people. And by educating those younger group of people, we're also engaging with the teachers, the school district, the parents, the families, right? By talking to a child, we're also talking to a lot of other people in that child's life, and hoping that there's a little bit of a ripple effect too. So all of those people are in the conversation. If you think, or if you're interested, we're always looking for new and engaging members that are collaborative. The last few months have really been centered around this small grant, and we've provided the funds, and we've kind of told these three organizations, like, take it from here. And so we're kind of looking for our next big step in this grant, and what we're going to do. It's hinged a little bit on the upcoming community health assessment, which we'll do probably towards the fall or winter of this coming year. And if this is still a priority for the citizens of West Allis, if we're going to continue this work in the same way, or if it needs to change a little bit. But yeah, it's definitely something where we need so many people at the table, because so many people are involved, right? It's not just when you go to the hospital. It's not just when you have a touch with an EMS or a police. It's when you're at school. It's when you're at work. It's when you're getting treatment. It's when you're at the health department. It's when you go in to pay your taxes. We're really trying to help the whole person. So yeah, any other questions? All right, I think that's it. You want to go to the next slide, Bob? That's it. Does anyone have anything that they want to know more about? Like I said, I would love to give you guys a better data breakdown. I didn't bring that today just because I wanted just to provide a brief overview. And now that I know you guys are really interested, I will definitely come with that data ready to go and a little bit more stratified. And I would love to invite our data analyst, Sarah, as well, if time allows, to a future meeting, so that we can really dive deep into that and come up with good solutions.
Well, my reaction is it makes me sad that we're seeing this high numbers. It kind of reminds me of when I moved into this area and how much work we had to do as an association to really just turn those numbers around. So I'm hopeful that those numbers are going to get better. And I definitely appreciate all the different partnerships to really continue to do this work.
Thanks, Daisy. Yeah, it's it's definitely eye-opening, but I also see it as an opportunity, right? It basically provided a map of how we can help and where we can help. And so we like to look at it that way. We now have actionable things. We have an action that we can take because we have something that we need to fix. We can start creating a plan. And so at the ViolenceFree West Allis Collaborative, we're looking for, all right, we see a problem. Hey, let's find out, like, is this data really telling the whole story? We've kind of identified, like, it's telling part. So that's our first goal. Get the whole story, get better data, find better data, make good partnerships with big and small systems, talk to people, talk to the community members to really find out what's going on and how we can best help and provide services. And then the second thing is, this is what we can do now. What's our dream? What can we do if we have every resource in the world, and how do we get to there? How can we work together to make that a reality? Or how do we scale it back? You know, if we see that something is working really well in Chicago or Milwaukee, can we replicate that on a smaller scale for our city in a way that works for our citizens and makes it safer, right? Everyone wants a safe place to live. No one moves into a house saying like, I hope I'm scared, right? Like everyone wants to feel safe in their home. And that's our biggest push for this collaborative, is making West Allis feel like home to people, making it feel safe in a place that they're proud to live. And so much goes into that. It's easy to say and hard to do, which is why we have to meet all the time, right? It's hard work, and we're willing to work hard. And I really appreciate you guys' time and really engaging. I hate presenting to people that don't listen. So it's so nice to really talk and really delve into this conversation and get good ideas. I'm going to take so many ideas back to the collaborative of things that I did not think of. That's why it's really awesome to talk with different community members and different leaders in the community about this work, because people have good ideas. You just have to wait. You just have to listen. And so I'm excited, and I'm excited to keep you guys updated on our progress.
Thanks, Francis.
That's all I have.
You have a
Thanks,
lot,
Fran.
Francis. You have a lot.
Excellent report. Good job.
Thank you. Thank y'all for your time.
Where the East Coast.
And now we can double back to communicable disease update. I believe Ashley will.
Yeah, so if you want to pull it up, we can go over it. So as we discussed in previous meetings, we're gonna
Can you guys see that? Can you see the communicable disease report?
I can't.
No, I still have the opioid violence.
You might just be sharing the specific PowerPoint, so go back to share screen.
but yeah, maybe stop sharing and share again.
Possibly just exit out and share again.
Stop share.
Yeah, and then go to new share. If it
Oh,
hits
there we
stop,
go.
yeah. Perfect.
If you're gonna have all of these at the same time.
Got it.
Okay, we should be seeing it now. So this time around, previously we've done a more general overview of all of the communicable diseases, but we're going to switch to doing that on more of a quarterly basis. And often there's not too much to note month to month. But this month we're doing a little bit of a deeper dive in COVID to just go over our numbers and then where we're at with some of the staffing, some of our activities, just to give you guys a better picture of where our response is at now versus how it previously had been. So I did what we've done it for every month really, is providing a basic overview of the numbers of our COVID cases. So that hasn't changed. Right now we're sitting at 7,710 positive cases, 622 probable cases. Of our cases, 562 have been hospitalized over the course of the start of COVID. So these numbers, just let me to be clear about that, are run from the start of this pandemic back in March of 2020 through the end of April. So not including the month of May. So these numbers are slightly higher if you're reading numbers we release on social media or anything like that. We've had 135 of our clients we're working with pass away. And of our contact investigations, we've done almost 4,000 of them. So those are not positive cases, but people that could have been or that have been exposed to COVID that we're tracking to ensure that they don't develop COVID. Of those, we have just over 3,000 that did not either didn't test to positive for COVID, they didn't develop symptoms. So when we say not a case, that does not mean that they 100% did not have COVID. It means that they didn't develop symptoms or they didn't get tested. So they easily could have, there's just no way for us to know that. But of those, we had 107 that developed symptoms, but we did not go and get tested to confirm that, and 264 that were tested to confirm that they did develop COVID. That's our breakdown for contact investigations. Then I just provided a really brief overview of kind of where we're at with our COVID investigation. So throughout the course of this, Bob actually just asked me to pull numbers about a week ago on how many contact tracers we've had over the course of this, and we were up over 20 hired on staff to help with our contact tracing throughout 2020, and right now we're down to 7. So we've decreased that because our numbers are decreasing, and also we've got some really great staff that are just on it, and they are very well trained and they know what they're doing. So we've got 3 city hires, so 3 temp employees that are employed through the city. And then we've got a contract that we're doing with Employment Milwaukee to take people out of unemployment and employ them through this branch to do contact tracing. So we're working with 4 employees through that program. So they pay to have them work with us through a grant that they have. And they're doing a lot of our contact tracing too. So we're down to 7 contact tracers. We are still doing full contact investigations. So what that means is any positive case gets contacted by one of our contact tracers. They do a structured interview with them, trying to investigate where they might have been exposed, who they possibly could have exposed, ensuring that they have the resources that they need in order to stay isolated, like food support, if they need any housing or income support, any kind of direct to resources they may need to ensure that they will stay home and they can do that safely. As well as Francis mentioned with the ViolenceFree Collaborative, you know, we'll ask about if they feel safe staying in their home, if it's a safe environment to be there. We then look at who they may have exposed and identify, you know, workplaces where there might have been exposure. Our contact tracers will contact, you know, workplaces that could have been exposed and have them look at employees that might need to quarantine. We're looking at, you know, providing assistance so household members can stay home and quarantine. And then other activities. So things are opening up. That means people are going more places, so there's more risk of exposure. So our contact tracers are still very much hard at work at notifying lots of people of exposure. And with the COVID vaccine now rolling out, that it does mean, thankfully, that, you know, some people that would have had to quarantine before no longer need to. If you're fully vaccinated, you spend 14 days after you received your vaccine, you not need to quarantine if it's exposed to a positive case of COVID. So
Okay, good.
we're seeing the. Oh, Stacey, were you saying something?
Okay, good.
Oh, I just talking to. So we're seeing those contact numbers decrease because thankfully many of the people that are perhaps in the household or that they may have exposed at work are now vaccinated. So that is helpful as well. One other note on there is throughout the course of the school year, the West Allis Milwaukee School District has been instrumental in helping us keep up on contact tracing of students. We just did not have the capacity to take on kind of quarantining large classrooms of kids. So their nursing staff over there has been leading that charge in partnership with us, and that's been spectacular. But with the school year ending, we will be taking back over that contact tracing for all of the clubs, things that are run through the rec department, school classes and sports. So that's something that our staff and our contact tracers will be taking back over from June here. And then we haven't really talked too much about the vaccine clinics that we're doing. So I wanted to briefly go over that. So thus far, this number is actually slightly higher because we had a couple clinics yesterday and today, but we provided just under 7,000 vaccines to, you know, West Allis residents or those that work in West Allis. Our staff have administered the Pfizer vaccine, Moderna, and Johnson & Johnson. So we're trying to have done all 3. And I provided a little overview of kind of the places that we've vaccinated thus far, our partnership that we're doing with MIH, and then and then some upcoming clinics that we have planned. So throughout the bulk of this, we were doing the majority of our vaccines just across the street here at the former Aurora Clinic, which has been a wonderful location to be able to pump, you know, hundreds of people through in one go, because our clinic, although great, is rather small here. So we just could not pump through the numbers we wanted to get vaccines to people. So we've been largely over there, but as you may have seen in the news, numbers are kind of starting to slow down, and the amount of people we're vaccinating has gone down as we've gotten to, you know, vaccinating a large percentage of our community. And therefore we're kind of taking the show on the road to reach people where they're at. So thus far we vaccinated here. We've been over at the former Aurora building. We've done in partnership with MIH. They've done some home visiting, as well as our nurses have done a lot of home visits. We've done home visits for over 40 individuals in West Allis that are homebound. provide vaccines to people that have a difficult or challenging time to get into a clinic. So that's been a great experience. We also have seen that West Milwaukee had a higher or lower rates of the vaccine utilization. So we did a clinic at St. John's Church to be in that area of town to hopefully reach people. We've also gone to all 3 of the high schools twice now. So we did the 16 plus population, and then when they released that the Pfizer vaccine can be at 12 and above, we went back and did a population of 14 and 15-year-olds with using a model of free parental consent. So parents signed off beforehand and we vaccinate them without parents on site. It just makes that process easier and more attainable for parents that are working and find it difficult to pull their kids out of school or leave work to get their children vaccinated. And then we also went to Village at Manor Park, one of our senior CBRS, in order to vaccinate the residents and staff that were missed in that initial cycle that was done with Walgreens. And then we've been partnering with the West Allis Fire Department MIH program. So as I mentioned, they helped with the homebound vaccine. So they did some of them as well. Francis mentioned this, but they have the community collaborative, which is at the Apostle Presbyterian Church every Wednesday for the past, I think, 4 Wednesdays now. We've been providing the Johnson & Johnson vaccine there with them to get vaccine out to people that are already using that service, so make it nice and convenient. And now twice we partnered with them to, on Tuesday nights from 5 to 10 p.m. to go out and do homeless outreach with the Street Angel program to try to reach that population too. So that's some activities we've been doing. And then we have a bunch of clinics planned. We're going to the 3 middle schools. I made them as upcoming, but we actually went to 2 of them today. So we went to Frank Lloyd Wright and Lane today. And tomorrow we're at West Milwaukee, vaccinating middle schoolers 12 and above. We're doing just over 200 of them, and they'll either today or tomorrow. So we have a lot of kids taking us up on that opportunity, which is great. Next week, Wednesday, we're at CMS at Community Medical Services on site, the methadone clinic, providing vaccine in the morning. Potentially looking at scouting up opportunities to come back to them to meet their different times as people are getting methadone. So we'll be on site there. Next Friday, we're going to the rec department to do a clinic on site there. And then the following week, I think we're at Allis Care Center vaccinating some of their residents, providing vaccine to some staff that was missed. And then the fire department is in partnership with us, is doing 2 events. So they're doing at West Allis or West Allian Brewing Company a beer and a shot event. So people that can get their vaccine, and if they are vaccinated, then they get a free beer. So hopefully that will get some people that are hesitant to get the vaccine. So they're going to be doing that on, I think it's next Friday, like 4 to 6. And then that Saturday, they're doing a smoke detector installation event. So going into the homes to install smoke detectors and carbon monoxide detectors. And then when they're in there, they'll be offered to provide a vaccine to someone who's in their home if they're interested. So we have a lot of kind of more innovative ways to reach people coming up. As much as we love using that site over there, we're not over there too much in the upcoming future because we are really just taking the show on the road and trying to meet people where they're at. So I wanted to just provide that as an overview, because when we share those numbers on social media or the website about the number of vaccines we're giving, we don't share the story behind the scene of all the places we're kind of trying to reach people in the community. That's all I have. Does anyone have any questions about our COVID data?
Wow. We had a very busy health department here.
Yeah.
Transition to more of the pop-up clinic
Uh-huh.
approach.
Yeah, we have some amazing nurses in particular that have been incredibly flexible with doing these like evening clinics, coming in extra early so they can pack up and we can get over to places right at the start of school. And I've just been running around like crazy, and we really appreciate them doing that.
Well, thank you very much, Ashley. Wow, that was really an exciting report. Lots of things happening in West Allis here.
The only thing I have to add is just in addition to what Ashley presented is running the most recent immunization numbers for the jurisdiction of West Allis. We're showing at about 45% of our resident population having received the vaccine to this point. So that keeps us in track with the county on the whole and comparable to where the state is on the whole as well. So those numbers have pretty much plateaued though in the past few weeks, in large part just because of the vaccine hesitancy. So the strategies that Ashley is putting forth with her team, is having a little incremental impact on the numbers. But I think too, it's also recognizing that the healthcare systems and the pharmacies are still, too contributing to the vaccines, and so at some point, I think it's going to be a transition, more of a pivot from reliance, to an extent on the health department and more so to your provider. And so, we're hoping that, we can continue to have the dialogue with our healthcare systems, Aurora and Freighter, to, continue to support, the larger community and not just the patient population. So thank you for that. Yeah, actually, a lot of stuff is going on the clinical side.
Yeah, I can see that. All right, if no one has any more questions of Ashley, then I guess we're on to legislative updates.
All
Do
right.
we have any today?
Yeah, just a couple. Actually, I'll just go ahead and give just a verbal update. For anyone who's mindful of just kind of some of the legislative activity in relation to the governor's biennial budget, there are a couple items in there that address potential prohibitive actions, largely coming out of the assembly. And so just a quick update, there was Assembly Bill 23, which was intended to prohibit the Department of Health Services from requiring individuals to receive a vaccine against COVID and any other variant or mutation of the SARS-CoV virus. So that was actually put forth as a bill by the Assembly that the governor vetoed, recognizing that really, at this point, the idea is we should not be limiting the ability of public health professionals and the tools and resources we have to try and control as much as we can. So that was his rationale in terms of vetoing that bill. And then there was also a Bill 24 that the Assembly put forth for hopeful passage that spoke to prohibiting local public health officers from taking any action to close or forbid gatherings in places of worship to control outbreaks and epidemics. Governor Evers also vetoed that. Again, recognizing that, in the course of a pandemic, especially at the scale that we've dealt with COVID being novel, we have to have the ability to use, again, our tools and resources to not just ideally prevent, but control, any outbreak activity that might stem from a place of worship. And so the idea is not to just automatically go to, this option to shut places down, but it's there if there's a need to do that. So had that bill passed, it would have just essentially pulled a lot of credibility from the public health community, but as well, really ineffective tool in just trying to control outbreaks as they occur. And so I just wanted to provide an update on those particular items that recently have kind of worked through the state legislature. And then for those of you who are attached to the Wisconsin Association of Local Health Departments and Boards, or WALDAB, they serve as one of our professional associations along with the Wisconsin Public Health Association. Through those two professional associations, they really represent the larger jurisdiction-specific public health community, at the state level. So they were the ones who really served as our champion to put forth recommendations to the governor's office that these particular bills should not be passed. So again, just a note of recognition to our own professional associations, and two, just be aware that much of the advocacy that is happening, in the state of Wisconsin is being facilitated through either WPHA or WALDAB. So that's all I have on that.
Very good. Okay, do we have a health department update?
Sure do. Couple items. Just to circle back, Paula Tran-Inzio, who presented to our board for the race, racism, and public health topic, did present to the committee of the whole on May 18th on the same topic. I would say, unfortunately, it was a little rushed, but she did have an opportunity to present to that committee. Little bit of discussion ensued, but in preparation for that, for the Board of Health, just want to also let you know that the city and the city administrator actually facilitated a conversation with departments and department heads prior to that meeting on May 18th, just to and really just to engage departments in conversation around health equity and what we are all doing as departments to at least address from our respective perspectives, what we're doing on this topic of health equity. So that document was shared with the Common Council for review and consideration, and Paula Tran also got a copy of that in preparation for her presentation. And so for us as a department, we'll still continue to push our health equity focus forward as we had started years ago, and we'll just continue with the momentum that has been put forth to this point. And we'll have some specific opportunity to talk a little bit more about certain aspects of what health equity means and how we might be able to push for certain aspects of health equity. So a quick update on that. On the personnel front, we still have some vacancies, in large part due to early retirements or just otherwise non-scheduled retirements. We are still recruiting for a public health nurse. Some challenges with that. The position has actually been posted now for about a month and a half or so, almost 2 months.
I think about just over a month.
Oh, okay. Seems like it's much longer than that.
I know. Me too. Feels like
Anyway,
way too.
we're not getting a whole lot of interest at this point, and so we're just keeping that position open. If you happen to know of any even clinical nurses who have an interest in community-based public health, please do encourage them to check out our application, or call myself or Ashley, and we'd be more than welcome to talk with whoever that might be. Yeah. In the works, we also have an environmental health team leader position that we are going to be recruiting for. That particular position is under review by city administration, and then also Carlson Detman, who does the classification and comp review for positions. So it appears though we're positioned to move forward on that, hopefully as soon as next week. So that would set up a structure where we'll have a lead person within that environmental team, which to this point we really don't have a demonstrated lead person. Denise Koenig, who is the long standing director at the senior center, is retiring next week, is her last day. And so in anticipation of that need to fill, we are going to create a position that essentially is a senior center coordinator level position. In large part because it's a coordinator position rather than a director position. It was because we had to abide by the conditions of essentially the early retirement stipulation, where we had to, as part of the replacement, not fill at the same level. There needed to be I think a 30% difference between the current salary and any new person that might come in that position. So we're working to actually create a senior center coordinator role that is under review at this point, again, with administration and Carlson Detman, and hoping we can proceed with that recruitment process here within the next couple weeks. Business manager Diane Doobie, as most of you know, retired and is, I think, doing very well up north, enjoying her time in the woods. We will be recruiting for her replacement as a business manager. And so again, that should become open within the next couple of weeks, if not sooner. And that's it on the updates as far as the vacancies. So yeah, we are going through some staff transitions in large part because of the early retirements, or the retirements in general. And yeah, we're hopeful that this is an opportunity for us just to, look at situations where, we might have some new alignments organizationally, and then also can just, maybe look at some scenarios where we can do some streamlining and other partnering with maybe some other departments to kind of help us with the service provision of things. So that's it on the vacancies. And then I am part of a senior services work group that is being facilitated by the mayor. And so this is a work group that was built into the mayor's budget for this year. And really the intent and purpose of this work group is to look at the current services and programs that the senior center is providing. And then in recognition of other assets, resources that might be, available in the city. And then as well, looking at needs and wants and wishes, what opportunities exist for the senior center to maybe expand and or also give consideration to, potentially programs and services that, might not be needed. But I think more importantly, looking at potential gaps where we can provide services to the senior community.
Is that Memory Cafe or Memory?
The Memory Cafe is still in place.
That's still
Yep.
in place?
So
And
this,
with COVID, right?
yeah, and so generally with things opening up more so, the senior center has begun to essentially reconstitute their programming. But per our recommendation, we're looking at them doing that as far as the classes in a staggered way. So then we really don't have large numbers of people in that building at any one time. So, so they are getting back into the process of offering services and programming. And Memory Cafe is definitely one of those. Yep.
They do have excellent programs at the senior center, and I think basically it would be appropriate if we would offer our congratulations to Denise. She has done a wonderful job with the senior center all these years, of working with our seniors in our community. And I wish her well, and I wish her a healthy, happy retirement, because she's certainly deserving of this. She was a very special lady to a lot of the seniors there, and I'm sure that she will be missed. Also, I'd like to say that the council was very appreciative of Paula's presentation. It was a hurried night that evening, However, I'm hoping that her message will be taken seriously by the council people.
Yep. Yeah, and we'll make sure that we get a note out to Denise on behalf of the Board of Health.
I would appreciate that.
Yeah.
As well as the board themselves. Next,
Yeah, so next meeting,
yes, we have to discuss that. We have,
so you
in the
got some,
past,
Nope.
yes.
Go ahead.
Sorry.
no, I was just gonna speak to particular of those who are new.
Yes, that's what.
And maybe you were gonna do that, so go for it. I'm sorry for interrupting.
No, that's all right.
Okay, so the Board of Health historically has essentially taken the summer off. And I believe just traditionally it's been June, July, and August, if that's correct. I'm looking to the veteran board members.
Was it all 3 months? Okay, yeah, I thought this was 2 months.
Okay,
I thought it
okay.
was-
June and July, okay.
And that-
Maybe I'm just thinking because for last year with COVID, I think we had an extended period and maybe
Oh,
we'll just
yeah.
have 3 or 4 months. out of
Thanks
it.
for veterans instead of old.
So 2 months, okay. So June and July,
And we go back in August.
Okay.
Did we? Yes. Right? Whoever's still in there.
Barb, yeah.
Right,
Barb,
that's right.
back in
That's
August, right?
That's right. That's right.
Okay.
That's how I remember it as well. But I don't really care because I won't be here in any case. So you go ahead and head whenever you want.
Okay, so that being the case, you're looking to August for your next meeting.
So we'll be back in August. Okay,
And then, so we would stick with, at this point, the fourth
the fourth Thursday,
Thursday.
which is,
I'm just pulling up my.
And we always had the option to call a meeting in the event of a necessity.
Correct. Yeah, we can always call special meetings. So that would be August 26th.
however, if there's something that comes up during the 2 months that we are off, we will be calling a meeting of the Board of Health if it's a serious circumstance.
Right.
Also, I want to,
I'm done.
thank John for his service. John was always a good one for our snacks. He enjoyed our snacks. We'll do this. However, we have Jane Edgar that is coming aboard to help our Board of Health, and we look forward to her input, as well as the other members that are new. We all always appreciate our members very much. So
Thank you.
welcome, Jane, to our Board of Health.
Thanks very much.
You're welcome. And I don't know if there's any other business to come or any questions of any members at this time. Otherwise, I'd entertain a motion to adjourn.
So moved.
Second.
Moved and seconded. Have a nice summer, everyone, and we'll look forward to seeing you in the fall. All those in
Thank you.
favor?
Bye.
Aye.
Hi.
Bye.
Vote. Carried. Have a happy summer, people.
Bye-bye.
Thank you. Bye.
Good night, everyone.
Bye.
Thank you.